We're going to talk about a model for nursing practice in the community, the nursing center. Nursing centers have increasingly become settings for nursing practice in the community. Some of the reasons why this is occurring is there is improved health status of individuals, families, and the communities. They have direct access to nurses and nursing models of care. These centers reflect values, beliefs, and science and skills of nursing models. They are guided and managed, mostly staffed by nurses. Some of the models focus on enhancing people's capacity to meet personal, family, and community responsibilities and interests, usually include community-based and culturally competent care, a holistic approach to care. They collaborate with interorganizational and interdisciplinary partnerships. They have multi-level interventions. Their practice is based on relationships. They combine people, place, approach, strategy, and there's a variety of models. There are many types of nursing centers, and each has a personality of its own. A center's mission, values, goals, and strategies, as well as its commitment to the community well-being, contributes to its profile. Organizational structure, federal tax status, and reimbursement systems also define the centers. Most nursing centers fit into several categories. There are health and wellness centers, and here they focus on health promotion, disease prevention, and management programs. There are comprehensive primary care centers, and they perform primary care as well as the things listed above. Special care centers focus on a particular group and their issues, and then there's other categories such as academic nursing centers. The foundations for development include Perspective of the World Health Organization and Healthy People 2020, who support the notion of nurse-managed health centers. They are firmly grounded in public health nursing profession. They have emerged from academic nursing programs from the 1970s to now. Team members include the director, who is the nurse executive, advanced practice nurses, other nurses and ancillary staff, educators, researchers, students, and other members. Businesses are also part of this model, and it is a business model. They have startup and sustainability, even grant monies which are on a diminishing scale. They have feasibility studies that can be done. For instance, can the organization and community support it? They develop a business plan, and are they cost effective? Those are some of the issues that occur with the business side of these centers. The evidence-based model practice has to abide by HIPAA, which can increase the costs. They have quality indicators, which have meaning for the community and the outcomes. They have quality improvement, and what they do for this is they have a pooling of national data, and they also include essential technology and information systems with the knowledge to link what they're doing, their interventions, to data collection. So why are these nursing centers going to be a part of the future? Well, they're going to be the emerging healthcare system. Nursing centers are the answer. There's not going to be enough acute care facilities to be able to care for all the people that need care, so nursing centers could be one of the answers. They're going to partner with national and regional organizations. The nursing workforce is shifting from an acute care setting to actually the community setting and the home-based setting. More people want to stay home. Being in the hospital increases their risk of developing infection, and they get exposed to bacteria and germs that aren't in the home or in the community. So this is the perfect answer. These nursing centers are going to be involved in policy development and health advocacy, and the use of the nursing process and the core functions of public health, assessment, policy development, and assurance are the logical approach for the case manager's practice. Case finding, identification of incentives, screening and intake, determining eligibility, assessment, identification of problems, problem prioritization and planning, advocating of clients' interests, and arranging delivery, monitoring client during service, and reassessment is going to be an ongoing part of case management. Case management and systems and processes performed by a population manager will be developed to monitor the health status, resources, and outcomes for a targeted population. Some of the strategies that will be used are utilization management. They'll have critical pathways. They'll have case management, disease management, and demand management. The role of the case manager will be broker, consultant, coordinator. They'll be educators. They'll facilitate the health for the client. There'll be a liaison between the client and other disciplines. There'll be a mentor. They'll monitor. They'll report to a physician or other agencies. They'll negotiate. They can be a client advocate, a researcher, and a systems allocator. So you can see in this triangle that the knowledge and skill requirements of the case manager are quite lengthy, because they're going to be involved in healthcare finances. They have to have clinical knowledge, skill, and maturity. They have to be aware of the available care resources. They have to be able to, plan transition. They have to have management skills, and a huge part of it, the case manager, is the teaching and education of the client. When advocating, they'll be informing, clarifying, affirming, illuminating, and generating alternatives. With regards to conflict management, they will be in the pre-negotiation stage, the negotiation stage, and the aftermath after the negotiation has taken place. They will collaborate with community organizations and other disciplines. They will have to be able to evaluate and monitor the research and be able to actually use the research, and they have to know how to use the research. They have to be able to improve their own performance. They will be a peer consultant. They'll have to know all of the eligibility requirements for the clientele. They'll have to have some knowledge of legal issues and information systems, as well as legislation, and they'll be involved in policy development. And one of the biggest things that they'll be involved in is management of outcomes in the ongoing evaluation process. The tools that the case manager needs are case management plans, so they'll have a number of contacts that they'll need. They'll have to be aware of the 1980s critical pathways that are developed. They'll use care maps and the best practice healthcare maps. They'll have some insight into life care planning. The current and future needs of the client over a lifespan will really help them to develop plans in coordination with the client. Some of the issues that are concerned in case management are legal issues, and these concerns and liabilities fall into 5 areas that include liability for managing the care, negligent referrals, experimental treatment, confidentiality and security, and fraud and abuse. Some possible ethical issues that may show up could be conflicts in advocacy, conflicts of responsibility, and main concern. Some of these may include obstruction of a person's autonomy by disrupting the continuity of care with changes brought about through case management. Beneficence may be reduced in dilemmas of balancing obligation to the person and allocation of services. Justice can be tested by inadequate distribution of health care with just quality. Non-maleficence can be challenged with lack of outcome measures and lack of evidence-based practice.